This is a 13-year-old male who sustained a closed distal tibia fibula fracture 5 weeks ago. So the guardians have been massaging with those local herbs and all those things, but with no profound results. So today he came presenting with pain in the distal part of the leg, with inability to use that very limb. So on examination, we found out very severe tenderness. I think because of the rubbing, you can see how the skin is scaly and trying to peel off, signifying how that rubbing has disturbed the epidermis. So it was deformed, and of course, with some crepitus. So he went ahead and, of course, requested for some x-rays to make sure that we investigate this patient appropriately, so that we may be able to come up with a definitive diagnosis. So this is the X-ray radiograph of this case, and we have two views. That is the epi and the lateral view. The epi view is on your left and the lateral view is on your right. We have two bones in the leg, and that is the tibia and the fibula. The tibia is the bigger one, the fibula is the smaller one. So we did only the ankle joint, or we included only the ankle joint in this radiograph because our injury on examination was closer to the ankle joint in relation to the knee joint. So there is also another special feature which we need to note. That is the unfused fascial plate, because this is a 13-year-old, and in a 13-year-old we still expect increase in length of a bone so that the height of the child can increase. So it shouldn't be mistaken to be a fracture. This fascial plate can be appreciated in the distal tibia, just above the ankle joint. Then we go to the fracture identification. Remember, we said you will follow that cortex all through. So we are moving from up to down, still in the epi view on your left. So as you move from up to up, moving down, you will appreciate a discontinuity just as you approach the metaphysis, and this will give you a transverse line when you try to follow that line. So we have a transverse pattern of a fracture both in the tibia and the fibula. Then also there is another special feature which is to do with these colors, which can be visibly seen in the radiograph as a signal that this injury is not fresh. You will see the colors when you try to still look closely at the cortex. As you approach it down where the fracture line is, you will see some substances that a little brighter compared to the other features that are surrounding, or compared to the other soft tissues that are just next to the bone cortex. So these features are a little off-white compared to the other soft tissues around. So it means they will absorb more rays compared to the other soft tissues, but not like the bone. So that's how you can appreciate that colors. So we shall also note that this fracture is laterally displaced when you try to compare the distal fragment in relation to the proximal. Then also in the lateral view, you will still see an anterior displacement, if you may mention, and that is to do with the position of the distal fragment in relation to the proximal. Thank you.